Hi, Dr. Lee.
Hello.
Yeah, that's my latest the CDC and
Okay,
the
gotcha.
CRP. Yeah,
That CRP is really climbing.
yeah, why?
It's the same unit.
That's April 28th, May 19th, and June 15th. So, it dropped significantly, but now it goes
And
up.
are you okay with me recording our conversation?
Yeah, sure, no problem.
So, when I look at your CT scan,
Yeah.
it looks like the area of pneumonias that you were having before is getting better.
Oh,
but
really?
you have new spots. And so what I suspect is happening is you had primary pneumonia, and then you got secondary organizing pneumonia on top of that. So as the number one reason for organizing pneumonia
Yeah.
is other infection. So when you have another infection, it primes up your body's immune system and it causes it to have excess inflammation. And so I think that you had pneumonia, and that's when you're having all the thick, mucus and higher fevers, and that got better. But then as that got better, you're developing this secondary organizing pneumonia on top of it.
So the April CT, right, with the contrast showed only the bottom lobe, multifocal, the patch, the consolidation. But then the middle of May, X-ray showed my left side completely resolved. So now the latest CT is showing that my whole lung has patched, consolidation, except for the right upper lobe.
So yes, I think that what happened is you had improved, like I said, you had pneumonia, you had gradual improvement of that, but now you're developing secondary organizing pneumonia on top of that. So the pneumonia the areas that we're seeing is not in necessarily the same areas that you had pneumonia before. So the areas that you had pneumonia before look like they were getting better on the CT scan, but you have new areas that are
You mean
up.
the bottom
Yes.
is getting better, right?
Yes.
Is more clear
Yes.
as compared with the April,
previous one.
right?
But then you have an area that's right above where you were before, and then we have some other ones on both sides.
But the old CT does not have anything in the middle or in the upper lobe, right? Nothing, right? Just the two bottom one.
I have to remind myself.
Oh. So when you compare April 28th and the June, right, the 15th CT, you can see clearly the bottom lobe is getting much better.
The bottom parts of the lung is better, but now you have areas in the other parts that weren't there. So I can actually show you if you'd like.
Okay, sure.
So this is your old CT scan, and this is the most recent one. So all this haziness down here is mostly getting better.
That's the old one?
Yeah, this is the old one, and this is the new one.
Oh.
So the area of inflammation that you had at the bottom of your lungs is mostly gone. You have a little bit of residual here, but then all this whiteness is pretty much gone when you compare. Okay.
Right.
But what's the newer areas is up here. So you have these kind of almost like these large balls that are forming, and that's kind of consistent of how organizing pneumonia looks like.
The old one does not have.
So
right, the three spots.
initially, so there's a little bit of kind of what we call ground glass, and now here it's more of a consolidation here. And then we didn't have anything here, but now we have this area of consolidation here. And then you also have this this area on the upper part of the lower lobe that wasn't there before.
Wow.
So the pneumonia that you had before looks like it's getting better, but now you just have new areas, and that makes me concerned about the secondary organizing pneumonia.
Oh, but what triggered the secondary
Pneumonia.
What triggered that?
Having pneumonia. So having any sort of respiratory infection will trigger secondary organizing pneumonia.
But I don't have the yellow flag or white phlegm also.
I understand, but it's the fact that you had the pneumonia.
Eh,
When you have any sort of respiratory infection,
Uh-huh.
that can trigger a reaction that causes the secondary organizing pneumonia.
oh, that's interesting.
Mhm.
All right. So, you mentioned organizing pneumonia. Is this organizing?
This is a secondary.
That is- Yeah, so
Oh,
it's organizing,
called-
it's organizing pneumonia, which
Uh-huh.
is basically when there's something that looks like pneumonia, but it's not infection, it's inflammation. And I think it's secondary to having the pneumonia before.
Oh.
But I can't say for sure, because really the only way to be sure would be for us to do a biopsy.
But the antibiotics, you think the antibiotics I took in the first 2 weeks of May helped or not? You
So
know?
I think that your regular pneumonia seems to have cleared up.
Okay.
So the bacterial infection, the infectious pneumonia looks like it's getting better.
Oh.
But now you have inflammation, and it's probably easier to call it pneumonitis, where it's more inflammation, not infection.
Uh-huh.
I don't think that I can't say for sure,
Yeah.
but I don't think that this is infection. I think that this is extra inflammation. Okay.
Okay.
So I think the antibiotics did what they were supposed to do, but now you have this additional inflammation that's popping up.
So it is my immunization system is doing some over
Yeah.
acting work.
Why, what called secondary organizing? No idea.
Well, again, this, the most common cause of secondary organizing pneumonia is having any sort of respiratory infection. And because you just had this pneumonia, that primed up your immune system to create this extra inflammation. That's the thought.
But other
Is that a common secondary common?
So when we look at organizing pneumonia, more than half the time we don't know why. But the most common cause of secondary organizing pneumonia is is respiratory infection. So of the known types of secondary organizing pneumonia, infection is the most common cause.
So is it possible like a third organizing?
No, there's no tertiary organizing pneumonia, no.
Only secondary?
Yes.
so
So
like
her,
what's the percentage of people?
I
so
don't.
her case is very special, not correct? Secondary, very special.
I don't know what you mean by that,
I
so.
mean, it's not a very popular, and so it's difficult.
It's not a common.
It's difficult to heal, not correct?
No. So when it's secondary organizing pneumonia, usually if you can get away from what causes it, which in this case is it's the infection, you actually you do better.
But my CRP goes up. What does that mean?
Again, it's the inflammation from that organizing pneumonia. And so, I that's why I said, sometimes to help this heal quicker, we give you steroids to help bring down the inflammation in your body and get rid of these lesions.
So you mean the OP could cause CRP going higher as well?
The CRP going higher is because you have the OP.
Oh,
Okay.
and also my low fever, like my body temperature just fluctuated between
Yes.
around the 99 or something,
Mhm.
right? Like a plus minus point something. So it's never go to the normal. I remember when it's supposed to be 98 or something. But it's around the 99 most of the time. It's very constantly for the past like 6 weeks. It's never changed. But I'm not bothered by the body temperature. It's just like, I can walk, I can run, like the staircase, no problem. There's no breathing, shortness of breathing while I'm walking. I do morning walking, evening walking, and do some chore work. I'm just like a normal person. It's just sometimes when I speak too fast, or occasionally I feel, wow, I have to stop. There's no air anymore. So that's this. See, the only two things bother me is just feel short of breathing occasionally during talking.
Mm-hmm.
And also the low fever, I wanted to find out what's the root cause of the low fever, right? Why I cannot go back to the normal temperature, like 98.65 or something. It's been always around the 99. I feel like I'm a normal person, do all the house chore work, yard work, no problem. But I feel, I just don't know what's going on, what happened inside my body. This is my first time to got pneumonia. Oh, I have some other symptom recently. There is air out of my stomach. Quite a few times a day, the air should go down, right? But it came out of my mouth from time to time.
Sometimes when you take a lot of antibiotics, it may upset your GI tract. So I don't know if that may be playing a part.
But stopped already a month ago, right? Like I stopped all the medicine in the middle of May. And the only change, the CRP goes higher from 31 to 53. 53 is pretty high, right?
It's quite high, yes.
But it's much lower than my April. April is 101. April 28 is 101. Right? So I still don't get it. It significantly dropped from 101 to 31 after finish all the antibiotics. So does that mean the antibiotics help?
Like I said, the antibiotics helped. It cleared up the regular pneumonia, but now you have that secondary organizing pneumonia.
Okay.
So that infection got better,
Okay.
inflammation is going up. Okay?
Yeah. It's just like I was still wondering what triggered this OP.
So I think that is secondary to the regular pneumonia.
Yeah.
So when you have bacterial pneumonia, it can cause additional inflammation in the body, and this causes the secondary organizing pneumonia.
Okay.
Okay?
So the CRP, the high CRP, is going up, right? Does not mean that I have bacteria, right, in my body.
CRP is a non-specific measure of inflammation.
Okay.
It can mean infection, but it can also mean inflammation as well. And I think in this situation, it's likely inflammation, not infection.
Every morning, my first phlegm is still very tiny yellow, and then the whole day is clear, nothing. So that's not infection, right? That's not a
The
bacteria.
color of mucus doesn't always correlate with infection.
Yeah, I was still wondering if necessary to do the culture, phlegm culture.
I don't think
Which
that
is-
is going to give do much benefit.
Because the yellow is from the bottom of the lung, right, which may contain some bacteria.
Like I said, I think that this is inflammation, it's not infection. So, whatever you culture, I don't know what clinical use it would be.
So far, you don't think I have bacteria in the lung anymore? Even
So
the
I-
CRP is high?
I can't say for sure. The appearance of the CT scan looks like organizing pneumonia, which is inflammation, not infection. Now, like I said, the best way for us to figure this out would be to do that procedure called a bronchoscopy, where we go in and do a washing.
But what's the primary purpose of that scope?
So we can get cultures and we can also get biopsy specimens to figure out what's going on.
That sounds like very scary. Yeah. Well, even like when sometimes you drink water, got choked, you feel like dying. But if I just.
So you're out for the procedure, you don't know what's going on.
Well, water is scary, yes. Because I'm feeling better day by day. Like a normal life. It's just the two symptoms. Well, short of breathing during talking sometimes, the low fever. If we, is there a different way to confirm that I got OP?
No, the only way you can confirm that you have OP is with a biopsy.
like the blood test.
There's no blood test that looks for OP.
Like it can isolate if there is any other bacteria or infection, like TB or some other test.
So there's no blood test that rules out infection completely. The
Okay.
best way for us to do is to
Yeah.
at least go down and do, if we don't do a biopsy, then just at least go down and do a washing so that we can get the best quality specimen and see if anything is growing in there.
Yeah. But like you're saying this patch, the consolidation, right, is moving around, right?
Mhm.
Like so like 1 month later the CT result may show the different place, right? This place is gone, then showing up in a different area.
Possibly.
Yeah. So, did I tell you that in 2021 I got hit by COVID-19?
Okay.
But I didn't got pneumonia. The COVID-19 become negative 1 week later, 10 days later. I didn't take any medicine, but I did have a high fever. Like 102 or something for about 1 week. But did result in similar shortness of breathing for like during the talking, right? For like 2 or 3 months until finally recovered. But I didn't take any medicine. It's just naturally, 2 weeks later I go back to my work.
Well, you what would you like for me to do for you?
So what is the most suggestion in this case?
So I would suggest one of two things. So either do a bronchoscopy to get a confirmation of whether there's something growing in there or not, with a washing, and then maybe even get a biopsy if you're up to it, just so that we can make the diagnosis. Or if you don't want to do a procedure, then I would recommend trying to empirically treat you with some steroids to see if this will cause these lesions to shrink.
Where the biopsy is done?
Northside Forsyth Hospital.
I mean the scope.
So it goes into your mouth and into your airway.
Yeah. I mean, where is it in a lab somewhere? I mean, where? Who performed the procedure?
So if it's just a simple washing, I can perform the procedure. If you want to get biopsies, then I would refer you to one of my colleagues, one of my pulmonologist colleagues. We do it in the endoscopy suite at Northside Forsyth Hospital.
Oh, what's his name?
It depends on the day which doctor does
Richard. Okay. You think a biopsy is absolutely necessary?
I don't think it's absolutely necessary. I think that it would certainly at least give us clinch the diagnosis for us so that we can be sure that giving you steroids would be a reasonable, a reasonable option. So it gives us a more definitive diagnosis because you seem to be hesitant about wanting to do any sort of steroid therapy.
Yeah.
But oftentimes, when I diagnose it by a CT scan, I'm usually right. And my patients will usually opt to just take the steroids and see how they do.
So regarding to the steroid, which will help to reduce the CRP, right? How soon the CRP can be reduced? Once started?
Pretty rapidly.
In 1 week or 10 days?
So we often track CRPs with patients in pneumonia in the hospital. It should drop pretty immediately. Within the even a day after the CRP drops significantly when we give patients steroids.
Okay, that means like if I take steroid, that's I forgot the name. You say the Prestine.
Prednisone.
Okay, prednisone. So you take even very tiny small dose. But I don't want to go with regular dose.
Okay.
Just for trial, for test, small test. Like take a tiny amount dose. What's the minimum dose for the lowest dose? Just for test purpose.
So I don't recommend doing prednisone for test purposes and low
I mean
doses of prednisone.
like
we don't use the CRP to track what's going on in the lungs.
Yeah.
We do it based on symptoms and imaging.
Yeah,
So,
because 6 months is a very long time,
Mhm.
you know, which will blow me like a
Sure.
moon, right?
I
Yeah.
hate doing steroids,
And
but you know, at the same time, you
Yeah,
know,
could-
it's the best thing that we have for this.
like
And
you-
if you don't want to do the high doses, I would say, you know, probably I would do 20 milligrams. So
Uh-huh.
oftentimes I use 40 to 80 milligrams.
20 milligram is
But-
for daily
Yes.
dose.
Mm-hmm.
Oh, so and 20 for like if we try that for 10 days and then I measure do the lab CRP. I wanted to see the CRP dropped, you know, and compare. Then if dropped a lot like lower than 20, for example,
Mm-hmm.
or 10, right? Ideally, I wanted to see the very low CRP. That means we're in the right direction. It is OP, right? If no change, if still CRP is measured like 50 or 40,
Mm-hmm.
no change at all, that means the steroid didn't
Well, it means that the
do
dose,
its work.
the dose of the steroid is not right? Because steroids, there's a dosage response. So if you're not giving enough steroids to overcome the inflammation, then it's not going to do anything. This
Because-
is why we usually do 40 to 60 to 80 milligrams
Yeah,
oftentimes.
Because I told you, right, I had a very poor experience with the steroid the
Mhm.
first time in April, right,
Mhm.
middle of April or the second week of April. At that time, my family doctor didn't say I got OP. The only reason he gave me that that steroid is to help me breathing better.
Mhm.
You know, to just because I cannot lie down on the bed, I cannot sleep while, you know, lying down. I have to just, sit and sleep. I just cannot sleep regularly. So he said, okay, I'll give you some steroid to help you sleeping better.
Mhm.
The only reason, but there's nobody ever mentioned the OP. Maybe at that time I already had the OP
So
or
we
something.
use steroids for a whole
everything.
variety of
Yeah.
inflammation. And
Okay.
sometimes when people have, when they have pneumonia, they can have airway inflammation or tissue inflammation, where the
Yeah.
steroids can still be helpful, even if it's not
Yeah.
OP. But at this point, it does look like it looked like you had pneumonia, and then it's transitioned to organizing pneumonia. Okay?
Yeah, April, the whole month, I don't have anything other than just that
Mhm.
steroid. Oh, no. The first week I took the artemisinin, for 1 week I didn't do the work and followed by 1 week of steroid, but that killed me.
Mhm.
Like I become worse and worse, even got high fever, higher than 102 or something, 101. And finally that's the major reason I got the first CT with contrast. Right, doctor said, okay, no X-ray, we go CT directly, with contrast. And that's my worst time.
Mhm.
High fever, I cannot sleep, lying down, I cannot breathing at all while I'm lying down. So I'm very scared by steroid, that's the time, my first time to take a steroid in April, and that's killing me. So now, I don't know. I just little worried about the steroid. So I say that maybe we can try a small, tiny amount, and then I wanted to measure the CRP. See
Again,
if-
I don't recommend low doses
Uh-huh.
because the low doses are not going to be enough to really control the inflammation.
but at least it should not go up, right? It should go down, maybe not dramatically, but it goes down like maybe 50% or something.
So,
Yeah.
there's no point in giving you a steroid if it's not going to do what it needs to do. And so that's why if we're going to do it, we should do a real dose. I wouldn't do a low dose. I don't see the point in that.
Yeah, because of my
So
My
how
concern.
urgent situation
Yeah.
is it?
I don't know. So this change, I can show you. Let me show you. So this was how your X-ray looked when I saw you. When I saw you in the office, right?
This is
You
a
don't-
survey.
yeah, this is the X-ray. So you don't, and this is the CT scan.
Yeah.
See, these are all new lesions in the course of this 1 month.
Oh, that's
Okay.
the X-ray we took here.
Yeah,
right?
that was the X-ray we took here.
Yeah.
This is all new.
Oh.
They were not there when I saw you in the office before.
Oh.
Okay.
Okay.
And so I don't know how rapidly, this is a pretty rapid change. And so my concern is if we sit and do nothing, if this keeps getting worse, then you can have worsening shortness of breath. You can develop a need for oxygen, you know. And so that's my concern if we just sit back and do nothing, because you had a pretty dramatic change over the course of this 1 month.
I think we did the X-ray on May 29th, right?
We did on May 19th.
On May 19th is the X-ray from the north side hospital.
Mhm.
I think on May 29th we took another X-ray here
Yes.
in this building.
It won't show up on the system, but then it looked pretty much the same or better than this. So,
Was
you
it
know,
better than that one?
yes. Mhm.
Oh.
So overall, you know, so if we did that May 29th, then this is an even more rapid change over the course of just a few weeks. And
The May 19th, that's the May 19th, right?
yes, mhm.
And then you don't see anything on the left lung, right?
You don't see very much, but you can see this new haziness here
Yeah.
and this haziness here that you don't see on this one.
Yeah, that's right after we stopped the antibiotics.
Mhm.
You know, the last day for the antibiotics is May 17th. May 18th.
So my concern is, you know, if there's sometimes OP can come and then can just go away on its own. So that's a possibility. But there's a possibility also that this continues to worsen. If it continues to worsen, it can cause significant respiratory issues.
So yeah, I don't know. I thought I was just wondering if possible to start a small dose of the steroid to see if the CRP, and then test the CRP to see if it's in the right direction.
Is bronchoscopy safe?
Yes.
How much?
What do you mean?
And she is worried about the scope.
The the bronchoscopy
Safe,
is
safe,
extremely safe. You know, our complication rates are very low. It's usually if we're just doing the washing, then that would mean that you do it under kind of like when you get a colonoscopy. So you get twilight anesthesia. You're out for the procedure, but we don't put you on a ventilator.
But if adding the biopsy,
Mm-hmm.
that's
Is it causing
Cause a
inflammation, bleeding?
So that's a possibility, but you know, even with the biopsies, most of all of our procedures are done outpatient for the most part, and you know, most of the only a small percentage of patients have to stay because of complications. They usually send them back the following day, and it's normal to have a little bit of bleeding. It just depends on the extent of the bleeding. But there is a little bit of bleeding, but for the most part, it's pretty well tolerated.
Every month, the CT. This CT is very harmful, right? The radiation is not suggested to do CT so frequently,
You
like
have to
once
do
a month.
You have to do what you have to do.
So
No.
what's the next suggested CT? I mean CRP and the CT.
So I don't normally check CRPs. That's
Oh.
usually not a part of what I do.
Oh,
We don't check CRPs. So you can choose to check CRPs with your primary care doctor,
yeah.
but generally speaking, we don't check CRPs.
Oh.
We do it based on imaging and your symptoms. Okay?
Okay, if we do CRP,
Okay.
is the blood level is down here in this building, or is still the same place, like the north side outpatient center?
I do blood work at the
Downstairs.
downstairs, yes.
Oh, I see. So, I don't know, you also mentioned the other day, you know, in the phone call, that could be in a monitor state for about 1 month.
That's up to you if that's the risk that you want to take.
Yeah.
Okay?
And then retake the
So
CT.
it is
That kind-
possible
Mhm.
after 1 month,
Mhm.
the situation may got worse.
It's possible,
Is it
yes.
possible?
So, this inflammation, if it's unchecked, it can continue to progress and cause worsening inflammation and damage to your lungs. Or there's a possibility that it can regress because if it's secondary to the regular pneumonia, then it could just kind of calm down since the regular pneumonia has been kind of getting better.
So your suggestion is to do the,
My suggestion would be either to start some amount of steroid, or to get a bronchoscopy, possibly with a biopsy, just to kind of get a more definitive diagnosis. It would be one of those two.
and do it as soon as possible?
I would say, for me, I would probably do it sooner rather than later.
How long I can wait and see if I'm getting better, you know,
I don't
during the
know.
observation.
I don't know.
And if we delay too much, and then you will need another CT.
So we can see these lesions on the X-ray. So for the immediate future, we can try to do X-rays instead of CT scans. To keep an eye out on this. So that we can kind of reduce your radiation exposure. But you probably need a CT scan at minimum every 3 months.
Oh,
Minimum,
minimum every 3 months, one time. What's the CT we have? Is that the HR CT, high resolution CT?
So it's not a high resolution CT scan.
Oh, even my first time is not high resolution.
No.
Okay, so is a high resolution CT better to see the problem?
No.
No.
In your situation, I think the problem is pretty clear. I don't think that getting a high resolution CT scan is going to make a difference.
Oh.
It's also more radiation and more expensive and more time consuming.
Oh.
So for the X-ray, how much frequently do you do?
At least every month.
Every month.
Oh. X-ray does not have that much radiation, like CT I heard is 100 times stronger.
The CT scan is probably 100 to 300 to 400 times more
Oh.
radiation than an X-ray,
300, oh my gosh.
depending on how many slices that they cut.
Yeah,
So
okay.
So, but you say, X-ray is not as accurate as CT. So every month you do X-ray is good enough, is it good enough?
I think that looking at the bigger lesions, when we look at your CT scan, I showed you that scalp film, so we can see just on something similar to an X-ray from our CT scan. This is called the scalp film. We can see it like an X-ray, what it looks like. So I can use an X-ray to be able to see if these types of lesions have gone away. So large lesions, they're helpful, but for kind of smaller, finer lesions, they're not quite as helpful.
But I did a 2 X-ray, none of them showed the upper lobe
Yes,
or middle lobe.
but again, I think that you had pneumonia and they got better, and now we're seeing new opacities. So these are different from what you had before. So I think that you were getting better, and then you developed this organized pneumonia on top.
Oh,
So if she do X-ray tomorrow, it's going to have a similar result.
Or at least just the scalp film. So these large lesions we can visualize these larger lesions on the
I mean,
regular X-ray.
you have the X-ray machine here, right? Can we do the X-ray here today to show if maybe
I wouldn't recommend it because we
maybe
have
CT
the CT
machine
scan
was
here.
broken the other day. I mean, how, any machine could have a malfunction times, right? I just,
So when it malfunctions, it doesn't not show things. That's not how it malfunctions. So
maybe your X-ray machine showing nothing, like maybe can we do an X-ray here?
I wouldn't recommend it. I mean, you just had the CT scan. I don't think that is going to change what we do.
Yeah, it's just that I'm very, very curious, that second CT result may not accurate.
That the CT read is not the CT is inaccurate.
What if that
That's-
way, the
There's
machine
no way that the CT is
broken.
inaccurate. That doesn't happen.
Okay, okay, yeah.
Mm-hmm.
I hope that's just my
No.
hope. Oh,
So
okay.
she concerned bronchoscope
Okay,
and also concerned about the stain.
I get that.
Mm.
But balance situation, maybe she have to do it.
In the end, it's up to you. I can't, force you to do anything, but those would be my top 2 recommendations.
Mm.
If you choose not to do them, then it's up to you, and we can just kind of to keep an eye out on you with an X-ray in about a month or so, just to see how things are going.
Mm.
But like I said, my concern is that if I can't predict the course of this. So if the inflammation keeps getting worse at this rate, then you can cause significant damage to your lungs.
Mm. So at least every month to do X-ray.
Well, if you want, you can go home and you can think about this. And you can give me a call back, on Monday and see what your thoughts are, okay? Because it seems like you're not quite ready to make a decision right now.
Yeah, I just want to.
And another worst case is to become the fiber elastic. How long is going to become?
That's something that happens over the course of weeks to months.
Weeks to months. Mm.
It just depends on if this, if the inflammation resolves quickly, like when you give steroids, then it's less likely to become permanently scarred. But if you just kind of leave the inflammation unchecked, you have a higher risk of developing scarring of the lung tissue.
Mm. So it's better to do it as early as possible.
Yeah. Yeah, I'm worried, frustrated. Yeah, to get this problem the first time in my life. What's the best number I can text you? Maybe I can. It's very hard for the office to connect.
I'm working over the weekend, so I don't take personal texts. So I would say
Yeah.
it would the best thing to do is leave me a voicemail or send me a message to the portal.
That's the front desk number.
That's the front desk, but this is my voicemail box. So you just leave a voicemail.
Okay, okay, sure. Thank you, Dr. Lee. Thank you so much. I just, I don't know. I'm just a little scared, not too.
So you say bronchoscope is pretty safe?
It's a very safe procedure.
Always safe? No problem? No any side effect?
We do. So there's no such thing as a medical procedure or a medication with no side effects. So everything there is a risk. The risks are relatively minimal with bronchoscopy. There is a risk of bleeding, there's risk of introducing infection, there's a risk of lung collapse if we do biopsy, but they're not common complications. The vast majority of our patients do very well after bronchoscopy and just go home and go on with their life. So the bronchoscopy, if you've ever had a colonoscopy, it's pretty similar to that.
But that can still not confirm I got OP or not, even with the biopsy. The biopsy cannot tell I got OP or not.
It can. Especially if you have a better quality biopsy, like if we did the robotic bronchoscopy, it should, you're probably going to get enough tissue to show if you have organized pneumonia.
But the OP is moving around, maybe they don't get it.
So when they do a robotic bronchoscopy, they do a CT scan right before you do it.
Oh, before the CT scan?
Yeah, right before the procedure, and they do a robotic mapping and navigation for the biopsy.
Wow, I just had a CT done, like a few days ago. That's going to be too fast.
So that means we have to do a CT again.
I don't want to do two CT within 1 month.
And the other thing is if you don't want to do the robotic bronchoscopy, I could do what's called a blind transbronchial biopsy. And what's that? We use an X-ray system to look to see where the lesion is before we biopsy. So it's, even if it moves, we still can see where to go based on the X-ray that we take.
Okay, I didn't know CT is required before the biopsy.
CT is only required if you do what we call a robotic bronchoscopy, which is our most advanced biopsy system.
Oh.
We have a less advanced, the way that the old way of doing it,
Yeah.
and for that you don't need to have a CT scan. But we use an X-ray system during the procedure to go to the area.
Which way is now more popular among all the patients?
So the robotic bronchoscopy is more accurate
Yeah.
with less complications, but it's much more expensive. You're under general anesthesia, so they put you on a breathing machine during the procedure.
How much expensive?
Very expensive.
Expensive.
Yeah.
Okay. Yeah.
So if it were me personally, I would just say try some steroids.
Oh. How soon you suggest I start steroid? How soon?
As soon as possible.
Like in 10 days or 15 days or something?
As in, I prescribe it to you and you take it after I prescribe it to you.
So, yeah, like
So it is a risk because we don't know exactly.
We can't be for sure. Now, I've taken care of a decent amount of organizing pneumonia, and the appearance on the CT scan is pretty typical for OP, whereas peripherally based, it tends to be more rounded, almost like a ball on the CT scan. Usually with pneumonia, it's kind of more diffuse. So this has a very typical appearance of organizing pneumonia, but we can never be 100%, right?
like not 100%.
So
How much percentage you think I got OP this time? Like based on so far what information we have.
I would say I'm more than 50% sure. I'm more than a coin flip. I would say I'm 70% sure that this is OP.
Yeah.
Okay, so you say if she take medicine tomorrow, okay, vitamin, and we still have some risky, right? It is still risky. So what will happen if worst case happen if she take the medicine tomorrow today?
I'm not sure the worst case of what happened.
You said without doing the scope,
Okay.
and we directly take the medicine, and this is a little bit risky, right? Because we don't know exactly. And my question is the risk. How risky it is?
So, the risks of treating empirically would mean, if there is an underlying infection that we're not treating, then, steroids is not going to help with that. So we're not treating that underlying problem, okay? Also, if it's not OP and we're giving you steroids, then you're just getting the side effects of steroids without the benefit.
Yeah.
So that's the biggest issue with starting the steroid empirically is is there a possibility that there's some other weird type of infection underlying all of this, or is this just inflammation? And if it's infection, then we're not treating the infection and we're just treating inflammation, and the steroids may counteract the body's ability to fight off the infection.
So going to be repeat what we, I was affected in April, right? I took the steroid there and getting worse because of the bacteria, right?
So how do we monitor the risk? So tomorrow, for example, tomorrow we're going to take the medicine, and then following the day after day, and then how do we monitor this procedure is correct? We can continue, or we need
Measure
to
the
stop.
CRP or something?
Not a CRP.
If you want, you can use
No,
the
yes,
CRP if you want.
not
Yeah.
CRP. I mean,
But
so you take the medicine.
and so that's where we'll have you come back and we'll get X-rays and we'll say, hey, is this getting better, worse,
Oh, okay.
or what's going on. Now, the COP can be helpful, but generally speaking, we don't use it. But, you know, in your situation, because we do have all these multiple data points, it possibly could be helpful.
So, okay, I understand what you mean. So your suggestion, there are two suggestions. One is to bronchoscope first. That is the safety way. And the second is the risk way is to just take the medicine to go to proceed.
It's
And
a little
that-
less risky because I wouldn't say it's the risky. The riskiest is to do nothing and watch. That's I am a little worried about that one. But it is a little less risky when you don't have all the data, and we're treating something inherently.
Yeah, I understand. So take the medicine and then monitor the process through the X-ray. So every week,
No, every month, right?
Every few weeks, yeah.
every
Or
few
every-
weeks.
Okay.
So I think the second procedure maybe you can try, right? So if the situation getting worse, and then we stop, and then go to the bronchoscope again, and then make a new decision.
But even when you do it, they still start with a small dose because of the risk. What if it's not OP? Right, what if I
Don't
still
do
have
that.
other
Doctor said
infection?
she will not do small amount dosing.
Yeah.
If we go.
No, I don't want to start with standard or regular dose.
We won't have to, I said that I won't do the regular dose, but I'm not going to do very little doses because you're not really going to get much benefit from very low doses.
Okay, what's the?
So I would say go in the middle, which is about 20 milligrams.
20. Is this decreasing like weekly?
So because I'm starting you at kind of a lower dose, I would probably keep you on this for an indefinite period of time.
How
At
long?
least, at the very least for the next month on 20 milligrams.
1 month?
Yeah, and then we can see how if you are getting better with the 20 milligrams, and then we can discuss coming down on the dose.
So the regular treatment is like the standard dose is 30, is that right?
No, the standard dose is usually about 60 to 80
Oh my
milligrams.
gosh, that's a lot. So what's the decreasing process? Like when I took the other.
So that's not the same. No. So that is for, you know, kind of acute bronchitis, asthma flares, and things like that. This is not the same process. Okay.
How
But
this one?
this is going to. There's not a specific thing. It's just dependent on how your symptoms are, how well you're tolerating the steroids, and how quickly your X-ray improves.
But this is not going to be stopped suddenly, right? Like
No.
like 6 months later, you know, you are taking like 30 milligrams every week, or it's then suddenly stopped. It's also needed
Yeah,
to be
it's going to be a gradual taper.
right.
But there's not a specific taper that is set.
Oh.
It's just dependent on how you respond to the medicine.
Yeah, like I take start with 20 milligrams, and then second month is 15 milligram, and the
Sure.
third month is 10.
Yeah,
right?
depending on how you respond.
Yeah.
You know.
But hopefully the best case would be, cured completely after 1 month of the steroid, and the CRP measured like 5 or 10.
But you have to understand that with
Yeah.
organizing pneumonia, sometimes if you stop the steroids, it will
Yeah.
come back. And so this is why we rarely just say, oh, everything's back to normal after a month, we're going to stop steroids. This is why we usually keep patients on some amount of steroid to
Yeah.
keep things from recurring.
Oh.
So the whole process is about 3 months minimum, to 6 months to 1 year.
Usually it's probably a 6 to 12 month process, if not even longer.
Oh my gosh, I cannot imagine what I become. My face going to be a moon, right? Like, I just, never took steroid before, other than the 1 week nightmare experience, which causing me all the trouble.
So if we tried, for example, 1 month, and then saw a little bit improvement, then that means this options is on the right way.
Is the right
Is
direction.
the right, so we just bypass the
Mhm.
bronchoscopy.
Mhm.
So 1 month, if 1 month is okay, then that means bypass to the bronchoscope.
Mhm. Now, obviously, if it's the time in between, you know, you're feeling horrible or your symptoms get worse, we can always say, well, we have to do the bronchoscopy, let's just get this done. So we can always change our minds. Or you're on the steroids and you're like, oh, the steroids are awful, I can't tolerate this. The only way that I'm going to do it is if I know that I actually have, you know, had this, and you want to have a confirmation of the diagnosis, then we can always do that too, you know. It doesn't mean that just because we choose one way, we can't do any of the other ways. It just means that we start that way, but we can always pivot if we need to, okay?
Okay.
And then during the process, has any options for the steroids, different kind of steroids?
No, that's the standard one.
Oh, standard.
That's the common one, right?
Prednisone is usually our most common steroid that we use,
Mm.
yes.
Right. I don't want to use the same, that's, I forgot the name, what is it called?
The Medrol dose pack, the methylprednisolone.
Yeah, something like that. The 65431. I don't like it. That one is too strong, right?
Well, if you can't make a decision right now, I don't see the point in us sitting here and standing. So why don't you guys think about it, and then I'll give you the weekend to think about it, and you can leave me a message and let me know what you decide. Okay?
Okay.
For now, I'll have you follow up with me in about a month
Yeah.
with an X-ray.
Okay.
And you during the now and this time, you can make a decision as to which way you want to proceed. Okay?
Okay.
Oh, where is that paper? That one? Oh, here, yeah. For the front desk is clean. Yeah, I think I wanted to do an X-ray. I'm really feeling better. I'm feeling better today. Yeah. Right. Okay. So we cannot do X-ray today, right?
I don't think it would make a big difference, to be honest.
No, I'm just
But-
curious. Is that possible to do an X-ray today?
Okay, hold on just 1 second.
Yeah, sure. Okay. Thank you.
我比较，那你或者多两张片。上次来的时候做了一次，
我这个扣子没事。
上一次来的时候
这
在这儿做了咱们3个
也
人。
放哪里？这个都搁在桌子上，这手机放。
Okay, so you ready?
Yeah.
Follow me,
Okay,
please.
sure.
I don't think it's gonna be a big deal.
Oh, no big deal?
Yeah.
Okay. These are the
Bra.
plastic ones, okay.
I mean, it's still gonna show up.
Or if you have a gown or a clothes, I can change.
Are you wearing a bra?
That's the only one
No?
I have today, yeah.
I think it should be fine.
Yeah, sure, fine, right?